physician wise. So there's just unfortunately not. I love it. I love seniors. I think it's the best population to work with. They do take a lot of your time up, and I think that's one area that people shy away from after coming out of residency. So take a lot of time, and the pay isn't as the same as somebody that might be working in a hospital. But that's not. I mean, I like the population. I love it.
Oh, I do too. I've taught school from first grade all the way up, and then CCE, which is our religious education, all ages. And I found there is nothing like working with the seniors because they're so much nicer.
Yep, that's a true statement.
You know, we grow up and you hear stories about some codgety old whatever. It's not like that at all. I've found with seniors, they are just so thankful just for your time, just to have somebody to offer a smile or somebody to listen to them. I just love that. So, Dr. Julie, I've got my names mixed up. We typically record these interviews, but as always, I forgot to push record. So it's just starting now. So can you tell us how the pandemic has changed your practice?
Oh, it's changed tremendously. I've never done any type of telehealth. I didn't even really know what Zoom was prior to March of this year. And I had to learn how to do telehealth within probably about 2 days. And so that was an interesting thing to learn. As you can see, I'm at home. One of our staff members tested positive for COVID, so we had to quarantine for 2 weeks. So that affects a lot of my own patients because they can't see me, obviously, in person. And with older adults, sometimes working computers, either they don't even have a computer or
we understand.
Yep.
We're so proud of this group.
I'm actually really
together 3 times a week on computer. And I don't think any of us had ever Zoomed before the pandemic. I don't think any of us had even heard the word,
no, it's great. So that poses a couple of challenges, obviously, for having some of my patients learn how to do this and access to healthcare, right? This kind of puts a challenge and another barrier to them.
Yes.
But it's slowly been working.
So you can't take temperatures or do blood pressure checks or any of that yet by telemedicine?
No, I mean, most of my patients have blood pressure devices because I encourage that generally. So most of them have it, and oftentimes I have an adult child or a loved one that's assisting them. So, and my nurse calls them always before me and gets everything. So usually I get a temperature, a heart rate, and a blood pressure. So at least I have that.
See. Now, so you work with senior citizens entirely, correct?
65 and up.
65 and up. So you must be billing through Medicare then?
Mostly through Medicare. Mm-hmm.
Does Medicare pay the same for a televisit as an in-person visit now?
They do, yes.
Okay.
Some private insurances have moved away during the height of the pandemic and everyone was in shutdown. They all across the board, everyone paid the same for an inpatient visit versus a telehealth. Some private insurance have moved to stop that. Medicare is right now indefinite, which is really good. The last time I talked to our billing department.
Excellent, excellent. So I understood though, with some people in other areas of medicine, such as counseling, they were not being reimbursed at the same rate for telemedicine as in person. But I believe that's changed because that just wasn't fair. Well, moving right along, what are the most frequent disease processes that you see in the elderly? What's the most common?
So your chronic conditions, I mean, hypertension or high blood pressure is probably one of your most common ones. I mean, if you get up to 65, about 1 in 3 of your older adults are going to have high blood pressure. Wow. So you have, so I would say inherently just your chronic problems, high blood pressure, diabetes, high cholesterol. When you start getting more specific to your geriatric syndromes, Some things will be osteoporosis, urinary incontinence, memory loss, frequent falls. It's a big one.
That's something I deal with on a weekly basis here. So
yeah,
that.
and so those are the more common ones I would say that we deal with. I hear often, I
It
guess.
surprises me that such a large percentage have high blood pressure when I understand that's very easily controlled with medicine nowadays.
Yeah, it is. I mean, when I say that is that they have a diagnosis of it, but those are chronic conditions that are, easily controlled if you follow up regularly. Same thing with diabetes and cholesterol.
Does diabetes play a large role in the health of the elderly, like high blood pressure does?
Sure. Yeah. It depends. So diabetes, it's a chronic condition. Again, that's easily well controlled with medications and diet. That's a big one. And it can definitely wreak havoc on your health if it's not well controlled. It changes a little bit on how aggressive we get with diabetes in regards to our old. So when I say old in the geriatric world, we're talking, 80s, 90s. Those we don't get too aggressive. We relax a little bit because we don't want them to go into a hypoglycemic effect problem either. So there's a big push in the geriatric world, and also it was in combination with the geriatric AGS, which is the American Geriatric Society, and the ABIM, which is the internal medicine group. They came up with basically a recommendation for diabetes, depending on the health of the patient. We have a couple really healthy 70-year-olds, and I mean, I do push them a little bit more to get that diabetes well under control. But if I have a not so healthy 70-year-old with a lot of memory problems, they're really confused, they don't even remember what they ate or if they're eating well, I back off, because I'm fine with them living at a little bit higher level of a sugar to prevent any kind of other problems that might have come along with that.
Can all type 2 diabetes be prevented through diet?
Not necessarily. Unfortunately, genetics play a big role in it too. So yes, you can probably push it off as long as you can by having a really nice controlled diet. But sometimes inevitably you may become diabetic, and at no fault of your own. But I will say your outcome will be a lot better if you follow a good diet.
What lifestyle change do you recommend and consider most important for improving quality of life with our senior citizens?
So I think diet plays a big role in our health. Yeah, I'd say diet and getting up and moving. Exercise. There's been some really good studies that have been published in the geriatric world. Just even modest movement throughout the day, multiple times throughout the day, you see so much benefit in reduction of falls, reduction in depression, and just overall stamina and health. So it doesn't have to be a dedicated, 45-minute workout. It can be a 5 to 10 minutes of just walking around, doing a little exercise, 3 to 4 times a day. And then that's a cumulative, 40 minutes if you do it 4 times a day.
So many years ago, 8, when I first brought my father-in-law into my home, he wasn't getting any exercise at all. And I was told that senior citizens, regardless of if they're chair bound, using a walker, anything, they need to be able to exercise or move for 10 minutes continuously, walking, etc. Well, I tried that, and it took more than 30 minutes to get 10 minutes of movement in. And of course, that was 8 years ago. Is that still recommended, that our seniors need to be able to walk or move for 10 minutes?
I don't feel like 10 minutes is a fixed number. I mean, I think even a 5 minute just getting up and moving you know, especially now in the pandemic, I
Can't
see a
even go to a
lot of
grocery
patients.
store in 5
Yeah,
minutes. You can't walk around through a grocery store in 5 minutes. Can't do
no,
it.
no, you know, and if a patient is either, especially if they're, you know, wheelchair bound, even just movement or bands is something, and they might be fatigued out within 5 minutes, and that's okay. You know, I just want an effort and a movement, and then progress to us. Okay, let's add on maybe another minute in another week or so, and just see how far we can go, because I feel like any movement is better than none.
So it sounds to me that you're recommending start with where you can with your senior citizens and then try for an extra 1 minute per week and build up at a very, very
And slowly build up until they can tolerate it. Mm-hmm.
Very good. We hear so much about diet, of course, and our blood sugar numbers, especially pertaining to diabetes and all of that. Do you have a special diet, low sugar or high fat or keto or meta or anything that you recommend to your patients?
You know, the only diet that's been really studied for geriatric syndromes like Parkinson's and dementia patients is actually the Mediterranean diet. That one, especially for Parkinson's, that one actually had some improvement throughout these. If you look at studies, right, that's kind of where we're always at, looking at what's the science behind it. That's the only one that's been shown to have any type of benefit. So I grew up on the Mediterranean diet with my parents, obviously, so I'm a big proponent of it anyways. I think overall it's a healthy diet. So, you know, you're talking fish, lean meats, low on your red meats, heavy on the vegetables, limit your sweets. I mean, and I also think the other thing I also try to push for is making it, trying to get some color in there. So your peppers and red peppers and green peppers and a lot of your cruciferous vegetables, broccoli, cauliflower, things like that. So that's the one I do push for if patients are willing to try it.
Your colors is what Rob, I think we Rob was.
Yep.
Here, eat your colors.
Because that's where you get a lot of your nutrient, you know, the vitamins and the minerals and things that, and we absorb a lot better if you are eating it dietary versus taking a supplement. So.
I see. Do you have any evidence of diet playing a role in your patient's cognitive function?
I mean, I don't have any specific evidence. I do see that numbers improve. Specifically, I can think I can pinpoint this exact patient. Actually, he's 81-year-old with heart failure, diabetes, seizure disorder, Parkinson's, hypertension, coronary artery disease. He has, I think, 2 stents in. He had a pulmonary embolism. He has a lot of chronic issues. And overall, his health was okay. Oh, sorry.
There's one of the littles. That must be Zachary, right?
It's Zachary. Sorry.
It's Zachary. Can you go to your grandma's? Look, your grandma's there too. Okay. Oh, he's so cute.
Sorry. We have them all home right now. And his biggest issue was lower extremity swelling. He had quite a bit of swelling in his legs. And his sugars were kind of doing this up and down. He was on insulin. We were having problems of him going down into the 50s and then going to the 200s, and it was all over the place. And his daughter took over his diet, and he lost, then they called me because he lost about 15 pounds within like 3 weeks, and it was all fluid because she just went really strict with low carbs, little salt, cleaned up his diet quite a bit to the point where he's like, yeah, it doesn't taste very well because it wasn't salted. So all of a sudden now his sugars were running really low into the 80s, 90s. I stopped actually his long acting insulin and his short acting insulin. We dropped one of the blood pressure medications because his blood pressure was dropping so low. So those are the kind of things I do see if the diet is a nice, clean diet and we're really watching everything pretty closely. So those are definitely things that I do see.
You mentioned that patient had a seizure disorder also. Did the seizures come under control with the change in diet?
He had been seizure free for a little while, so that wasn't, yeah. He's been on the same medication for a very long time and hasn't had an issue with it.
One of my sisters was telling me that there is a THC product, one of the medical marijuanas that controls seizures. Have you heard of that?
Oh, mm-mm.
Okay, I figured it was a rumor because I mean it's like what? You know.
What is interesting is keto diet for kids and seizures have been there have been some improvement with seizures with keto and kid seizures. I don't know that all the details in that regard, but I have heard that before.
When you were speaking about exercise just a couple of minutes ago, you barely mentioned depression. Is depression very common with the elderly patients?
Yes.
Yes.
Yeah, unfortunately, I've seen it more lately with the pandemic because of the isolation, the lack of able to see family, especially if they live alone, and they're scared. I mean, they're scared of the pandemic, of getting sick and catching, COVID-19. So they either haven't left their house. I mean, I've had patients that haven't left their house since March. They get everything delivered. Their families drop stuff at the door and they leave. There's no contact. We don't do well when we don't have contact with people, especially our loved ones.
That's right. When you were mentioning, the top lifestyle things that improve quality of life, diet and exercise, I was wondering if socialization and spirituality and all of that would go into that list also.
Absolutely.
I used to believe that diet was the number one also when it came to senior health, but now I'm leaning more to the socialization, just having that person-to-person contact, just because we've been isolated for so many months now. Of course, I don't have any research to back it up, so I was just hoping for someone else to share that opinion. No,
I think it does. I mean, I also have a lot of patients that are in assisted living facilities and they're on lockdown. So all of a sudden they're not able to eat in the community dining hall. So I've had a lot of people lose weight because, they get their food dropped off in their own little apartment in the assisted living and they just don't eat as much because that has been proven actually in assisted living facilities and in nursing homes that people do a lot better when you are eating in a community setting. And that's why if you go to a skilled nursing facility, everyone is eating at a dining table because that has been shown to improve weight, maintaining weight or weight gain.
So the nursing homes are still on lockdown in the Las Vegas area?
Yes. In regards to like outside people coming in. I've had slowly, so I have a couple of assisted living. They are able to go to the doctor's office, which is nice. Initially in March and April, I had to go to home visits, full garb, everything, all PPE. But there's one group home that still, she really doesn't want anybody leaving, but I said, look, she's got to come and see me. So, so things are more like outside people can't go in, but people can slowly go to the physicians.
That is hard. That is hard. So all of your patients have some kind of a chronic condition or something, or they wouldn't see you, right? Is that fair to say that nobody goes just to maintain their health?
I have maybe 2 patients that I see once a year.
Okay.
Yeah, but that's not too often. On the most part, they are.
On the most part, your patients are sick, right?
On the most part, yeah. And I have a heavier older population, like more
Yes,
the 70s to 90 range is my
yes.
population.
And of the population that, I'm using the word sick, I don't even know if that's the correct word to use in this case, but of that population, what percentage would you say suffer from depression because of their underlying conditions or anything else?
Ooh. So it'd be hard to say between pre-COVID and hard after COVID.
Okay, that's right, because COVID, the numbers probably skyrocketed,
It
right?
really did. And I had a lot of patients that were well maintained, and then things just got a lot worse. They were either off antidepressant or they're on an antidepressant, but doing well and maintaining and able to go play their cards, able to go to the community center. And when all that stopped, just like I think the most of us, that we kind of were naive at the very beginning. We thought this was going to be, a few weeks, we'll be back to normal. Clearly that was not the case. And I think, you've heard of COVID fatigue or pandemic fatigue that has set in for a lot of people. So I think that percentage has gone up significantly to a high percentage in probably the 80s, I would say.
Well,
Um,
oh, so a high percentage into the 80s, you mean 80% or 80-year-olds?
80%.
80%. Okay. Is depression easily controlled with medication in senior citizens like it is with younger populations?
It's not easily controlled because the situation is not going to change. I have several patients that are on medication, and we talk about it, especially in our telehealth. Is it working for you? Is this medication not working for you? Do you want to up it or try something else? And at the reality, and they understand also, they kind of have a self-reflection that, well, I don't know if a medication change will make a difference because I still can't go anywhere. I can't see my friends. I can't do what I want to do. So then I say, okay, well, let's modify a little bit of our day-to-day activity and get on a routine and maybe try to have some more social interaction, whether it's FaceTime, Zooming, getting involved in something online to try to mitigate some of those isolation feelings. So then I started to think of what other way can we treat our depression other than medication.
So you are saying find some other way to socialize then other than in person, be it FaceTime calls or
getting out in the car, driving. That's another thing. I just encourage people just to get out of the house.
Outside of the house. Okay.
Yeah, I have, when I talk about, she's 83, lives with her daughter, very limited in walks with a walker, in wheelchair most of the time, but she hadn't left the house up until August, I think. And then finally they got in the car and drove around, and she said her mom's spirits were just lifted quite a bit for 2 days. So I encourage them to continue to do that. Yes, they can't get out, but at least we live in Las Vegas, so there's so much to see just driving. So just to drive even down the strip oftentimes gets people a little bit better mood.
Break them out of their funk. Yeah, I'm finding that I need to get out a little bit myself with this staying home. Now, we know that the elderly who have strokes usually go through a recovery period, and Medicare covers speech pathology to help them resume their language skills. Is speech therapy ordered for people with memory loss, and is it effective to help those with memory loss?
So you can order speech therapy. I think, my mom actually has went through it. So I don't know, I'll be honest, I'm not too familiar if there's any evidence with memory loss in speech and what they've actually can accomplish. I feel if the speech is secondary to an actual speech issue, then maybe they will be able to, i.e. the stroke, right? So it's an aphasia of some sort. Whether it hit a certain part that, you know, our speech centers on our left side of our brain, and there's different parts of that speech center. And if that is a vascular component to the memory loss, and it's affecting their speech / cognition, I think that will help. But if it's a straight memory loss that's more of an Alzheimer's picture, I don't know how effective that would be, because it's not the speech part of the brain, it's more of the higher part of the memory that's affecting the speech, if that makes sense.
Yeah, yes. I see. Well, Dr. Julie, we are just about out of time, but I do want to ask you one more two-part question. What would be your best tip that you could give someone on maintaining or improving their neurological health, and your best tip on maintaining or improving their physical health?
That's well, cognitively, yeah. So, and for cognitive improvement for health, you know, as most of you guys probably know, that we don't have a cure for a lot of these diseases. There are medications that hopefully slow down the progression of this disease, but it is a progressive disease. It's a degenerative disease. So how I always tell my patients is, how do we got to work out our brain. So we have to continue to be engaged as much as possible. Doing things like this on a computer is fantastic. Playing games, whether word search, crossword puzzles. If someone likes to knit, I encourage them to maintain their hobbies that they like to maintain in a safe manner. That's the other big thing.
So you summed it up with work out your brain.
Work out your brain.
And what about for the physical? What would be the one?
Like going back to what I said earlier, is just getting moving around as much as possible to safely. That's the other thing. I'm a big component of just being safe.
Okay, move safely. Okay, got that down. Well, thank you so much, Dr. Julie, for joining us today. It's been nice to meet you, and
bye, Julie. I love you.
Love you too, Mom.
And we'll let you go. We only got to see Zachary, but we heard about Elise and Thomas. They didn't pop by, but maybe if we see you again, they'll pass by.
Okay.
So again, thank you for joining us.
No problem. Bye-bye.
Bye-bye.